This resource is being made available by the experts at Senior American Insurance Agency and MedicarePlanChoice.com. If you're watching this video from a CD, telephone support is available every business day from 8 a.m. to 3 p.m. Eastern Standard at 800-332-7557. To get support from the MedicarePlanChoice.com website, simply click on Web Chat or Health Coach and follow the instructions. I hope you've already watched the other videos on the basics of Medicare, the 2 ways that you can receive your Medicare, and Medicare supplement policies. This video will focus on receiving your Medicare benefits through a Part C Medicare Advantage plan. Okay, Medicare Advantage, what is it? How do you get it? There's a lot of questions about that particular subject. This video is going to focus on the fact that there's 2 different ways to get your Medicare, and Medicare Advantage is obviously one of those popular choices. Why is it popular? We're going to discuss the types of Medicare Advantage plans that you can enroll in, the items to consider when you're looking at Medicare Advantage plans, what time periods do you have to make those choices, and where to look for extra help. If you haven't watched our video, The 2 Ways to Get Your Medicare, I suggest that you actually stop and go watch that video first, because that will give you a more rounded understanding of the subject. But for right now, we'll just break it down. Medicare fundamentally says that there's 2 different ways that you can get your benefits from the Medicare program, either Original Medicare or Medicare Advantage. If you decide to go Original Medicare, that consists of Part A benefits the hospital, Part B benefits the medical. You can have an optional Part D prescription drug coverage, and you can have an optional supplemental policy. Whether that supplemental policy is a standalone Medicare supplement policy, it could be group insurance, or it could even be military related like TRICARE. Medicare Advantage plans are administered by private insurance companies. They're approved by Medicare, but they're administered by private companies. Simply put, Medicare Advantage plans wrap the Part A hospital, the Part B medical, and in many cases the Part D prescription drug benefits in a plan that's administered by a private insurance company. These plans are approved by Medicare, and they have to follow the Medicare guidelines. That's just a brief understanding. Again, if you haven't watched the 2 Ways to Get Your Medicare video, that'll give you a more rounded understanding. This will be a very quick understanding, and we're going to focus this video on Medicare Advantage. We just talked about the fact that there's 2 fundamental ways to get your Medicare, with Original Medicare and a possible Part D and a Medicare supplement policy, or a Medicare Advantage Part C plan. What this screen is going to do is going to give you a little bit of a comparison between a person who purchased a Medicare supplement policy and a Part D plan, and another person who purchased a fictitious Medicare Advantage plan. So this Medicare Advantage plan on the right hand column is not a specific plan, it's a fictitious plan. However, the benefits within this plan are similar to benefits that might be available in a current Medicare Advantage plan. The idea is people who are using smaller amounts of healthcare services can actually save with a Medicare Advantage plan. Let's take a look at the details. If we watch the previous video on Medicare supplement policies, Plan F is a very common plan, and when you combine that with a Part D Medicare Part D prescription drug plan, a person could easily spend $250 a month premium for that combination. That would total an annual premium of $3,000, and then if that person used just 4 primary care doctor visits, 2 specialist visits throughout the year, and 1 emergency room service, there wouldn't have been any out-of-pocket expenses, because the Medicare Plan F paid everything that Medicare did not. However, you did end up paying $3,000 in premium for those services. So if you divided $3,000 by this number of services that you use, 7, you come up with a per service fee of $428 a service. So that's how much you would have paid when you combine the Medicare supplement premium and the Part D premium, and you divide that by the number of services that you use. Now let's take a look at a person who has a fictitious Medicare Advantage plan. They paid a $50 monthly premium as compared to $250. The annual premium therefore is $600 versus $3,000. If they use the same number of services for primary doctor visits, we're going to say they paid $20 a piece for each one of those. So that would be a $80 copayment. 2 specialist visits at $40 a piece is $80. 1 emergency room visit at $65. So the total premium with all the copays added in there, this person paid a total cost of $825. If you divide that by the same 7 services, that comes out to be an average per service cost of $117 versus the average per service cost of $428. That's a whopping 72% less out-of-pocket expense with a Medicare Advantage plan. Now, granted, if you used more services in a Medicare Advantage plan, there would be more copays. But the idea, people that are using small amounts of services can pay lower out-of-pocket expenses with a Medicare Advantage plan. And the idea is, if you wanted a more comprehensive Medicare Advantage plan, you can change every single year and possibly get a more comprehensive policy later on if your healthcare services were starting to use more. So that's just a comparison between the original Medicare on a person purchasing a Plan F supplement and a Part D plan, and a person purchasing a fictitious Medicare Advantage plan. I think you can see that a person that's using very small amounts of services can benefit with a Medicare Advantage plan here. Why would somebody choose a Medicare Advantage plans? Well, there's several different reasons why people would make those choices. Medicare Advantage plans are, as we discussed, administered by private insurance companies, and because they're administered by private insurance companies, you can also have a private insurance agent that gives you service. So that agent can provide service on claims, on prescription drugs, anything that you need assistance for, you can have a person there to help. That's important. Many of these plans obviously offer a neat package: doctor benefits, hospital benefits, and drug benefits all in one card. So you just show your card and it all goes billed through the plan. They can provide additional benefits because these plans get paid money by Medicare to do administration. They can spend that money on things like hearing benefits and dental benefits that Medicare does not even cover. That makes them attractive. Monthly premiums. Medicare supplement policy rates can be on the high side. Medicare Advantage plans in some states and counties are as low as $0. That makes them obviously attractive premium-wise. And because of the fact that there's no pre-existing conditions, you can always change plans from one year to the next and not have to worry about whether the pre-existing conditions will be covered. They will be covered by the next plan because you had coverage in the prior year. So because the Medicare Advantage plans do offer different levels of out-of-pocket expenses, that makes them attractive because you can always change to, let's say, a more comprehensive plan down the road. In just a moment, we're going to take a look at the types of Medicare Advantage plans. Medicare Advantage plans typically have 4 formats in which they're operated. First of all, an HMO, or a health maintenance organization. HMOs typically have contracted doctors and hospitals, and they ask you to go to those contracted doctors and hospitals. Many of the HMOs do a very good job at coordinating your care between your primary care physician and different specialists that you might have to go to. PPOs are preferred provider organizations. They also have contracted doctors and hospitals. In a PPO, if you go to one of the contracted physicians, you typically pay a lower out-of-pocket expense than if you use a non-contracted or an out-of-network provider. So the benefit to a PPO is the fact that it allows you to use other doctors outside of the PPO network. Private fee-for-service plans are considered to be the least restrictive. You can use any doctor in any hospital in the United States as long as that doctor and hospital is willing to accept the plan's terms and conditions. Special needs plans are really designed for specific people groups, and there's generally enrollment criteria that you need to meet in order to join those types of special needs plans. Two of the common plans are people that have Medicare and state medical assistance, also known as Medicaid, and people that have chronic health conditions like heart disease and diabetes. So those are just some of the different types of Medicare Advantage plans. It doesn't matter which one you join. They just offer different formats in which you might receive your healthcare needs. In order to join a Medicare Advantage plan, there has to be something called an election period, and we're going to look at 4 common election periods in Medicare. The first is the initial election period. This is when you're turning 65 and getting Medicare for the first time. You have the 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. So anytime during that 7-month period, you can join a Medicare Advantage plan. During the annual election period, this happens every year between October 15th to December 7th, and during that time you can make changes to your Medicare any way that you see fit with either Medicare Advantage or Original Medicare and Part D plans. There's many different special election periods. They can be used anytime during the year if you qualify for a special election period. People that have low-income subsidy, if you get extra help from Social Security, if you have a state pharmaceutical assistance program, if you have Medicaid, if you move out of the service area, there's many different types of special election periods, and they can generally be used anytime. The annual disenrollment period for Medicare is between January 1st to February 15th. During that time, it allows you to leave a Medicare Advantage plan and go back to Original Medicare. It does not allow you to go from Original Medicare into a Medicare Advantage plan, only the other way around. You can leave a Medicare Advantage plan and go back to Original Medicare, and if you'd like, you can also pick up a Part D. So those are some of the common election periods that you can use to join a Medicare Advantage plan. We've already discussed why Medicare Advantage plans are attractive, and these are some of the things that you might want to consider if you're considering joining a Medicare Advantage plan. Low monthly premiums. If you don't want to spend a lot of money in monthly premium and you're willing to pay some out-of-pocket expenses as you use the services, that's a great way to go. Obviously, as we discussed, you can get all your Part A hospital, Part B medical, and Part D drug benefits all in one plan, so you have one convenient card to use for all your healthcare needs. You can get coordinated care by using doctors within the network if you join a HMO or a PPO. You can get additional benefits from some of the Medicare Advantage plans that Original Medicare does not provide. And you can change to a different plan every year. I think that's probably one of the most important things, is the fact that you can adjust your Medicare Advantage plan to the healthcare services and the health conditions that you now have. And every year you can make those determinations. If you want to get to a more comprehensive plan that maybe charges a little bit more, but you have lower out-of-pocket expenses, or even change to a Medicare supplement policy. Because you can make those changes every year, it gives you the opportunity to adjust. And that's important. So those are some of the things to consider if you're considering joining a Medicare Advantage plan. If you've received a DVD by mail, you may have a quote on a Medicare Advantage Part C plan included right in your package. Simply fill out the application and mail it back to accept that offer. If you're watching this video through the MedicarePlanChoice.com website, go to Get a Quote or web chat to find out the Part C Medicare Advantage plans available to you in your state and county. If you need assistance with enrollment or need to discuss your individual circumstances, click on Health Coach or call our telephone support line every business day, Monday through Friday, 8 a.m. to 3 p.m. Eastern Standard at 800-332-7557. Thank you for trusting us to be your resource on Medicare information and products. We promise to give you our best effort with any needs that you might have as a client. And again, thank you for allowing us to fulfill our goal as being the #1 service agency for new Medicare enrollees. Thanks for watching.